Well, we're here with Dr. Wishnie, a podiatrist. Dr. Wishnie, you have one practice in Piscataway, New Jersey, and I think you have another one also. Where is that?
That's correct, Helmut. I have another one in Hillsborough, New Jersey. That's
okay.
About 20 minutes away, central New Jersey.
Got it. Well, Dr. Wishnie, I want to ask you a question about your practice. You see, we patients, we go to a doctor, any doctor, whether it's a podiatrist or a dentist or an MD. And on one hand, we believe that a doctor is a doctor because he has a diploma, he got the certification, he's licensed, and we can trust him. And I'm sure there's lots of truth to that. At the same token, however, we want to match the person a little bit the way we try to match our spouse. Maybe not quite as severe, but nevertheless, we try to get a feeling of what the philosophy of this doctor is and what type of patients he routinely sees, what procedures he does, because we have still noticed that even though every doctor is trained in almost everything, they don't always do everything, and they have different approaches, many ways to Rome. So tell us a little bit about your philosophy, your practice, if you don't mind, and if you can add on it, what made you become a podiatrist, Dr. Wishnie?
Okay, I'll answer that one first because that's a question I get all the time. And I guess it started when I was about 9 years old. I had asthma, I was sick a lot, and I was seeing doctors. And so the doctors always made me feel better, and I always wanted to be a pediatrician. But as I got older, I loved sports medicine, I loved helping people right away, and podiatry was just a great avenue to go and treat athletes. As well as we see all kinds of people from infants to elderly. I mean, I just had the other day a couple 100-year-old patients that are just doing great and just need regular foot care, and it's just great to see them. So going back to our philosophy is that what I think makes us special is that every doctor says, you know what, we listen to our patients, but we truly listen. We want to know what's going on in your life. What is keeping you up at night? Everybody, a lot of people have heel pain or a lot of bunions or other kind of foot problems. But your lifestyle might be different. You might have children to take care of. You might have a really busy job. And you might not be able to take time off from work. You're a crazy runner like I am, and you don't want to stop running. And I really won't tell you to do that unless you really, really have to. So our philosophy is to really listen and match our protocols with your lifestyle.
Got it. So what type of, especially in podiatry, but probably in all medicines, there is this thing called aggressive and conservative. You go to one podiatrist and he kind of says, look, let's do a little bit of this. Let's put some orthotics in, some inserts to this. And you go to another person and he wants to approach it with a surgery. And most likely both ways get the person somewhere. Tell us a little bit what your overall approach is when a patient comes with a bunion or with a heel spur problem where, his foot is just simply hurting below or above the arch somewhere. What are some of the ways you would like to approach it, if possible?
Well, we always try to do conservative treatment first. Conservatively, we try to get certain things to get better with just, like you said, orthotics or conservative approaches, non-surgical approaches to get them to continue doing the things they love to do. But sometimes you do have patients come in and their feet are truly a mess, and they really need to get fixed. So you have to be honest with the patient. You can say, well, we can try padding, I can trim your calluses, I can make your orthotics, I can do alter your shoes. And by the way, we have a certified podiatrist on staff who can help you with that. So we can do all that. But, let's say, okay, Mrs. Jones, we can do that. But what you really want, let me find out what you really want. What is your goal? Is your goal to get healthy and better quickly so you can go back and do the things you love to do? And I said, okay, this is the best way to do it. So I'm going to give you all the options. I'm going to give you my opinion. But overall, you're going to tell me what's best for you at this time in your life right now.
So what you're saying, there sometimes is a reason to go for, let's say, a more aggressive now rather than or wait for a more aggressive another year or two, or for that much a half a year, based on the current circumstances, the current conditions of the person, not only with his matter of health in his foot, but also with his outside particular thing. If a person knows he goes on vacation to Paris in 3 months or in 3 weeks or whatever, and will walk a lot there, then based on that, maybe the treatment will change a little bit and do certain things afterwards and certain things before. I'm just coming up with baloney here, but basically, right. I got it. Well, all right. And you did say you just saw patients which are 100 years old, and you do sports medicine, so you see lots of young people who kind of school children and stuff who get hurt and stuff like that. Is that what it is?
Well, we see kids and children who participate in sports, and I see a lot of children in general. Matter of fact, like I said to you, I used to want to be a pediatrician. I love children. I think I have a good nature with them. I understand them. And then, we treat, the weekend warrior, the athlete that likes to run about 20 miles over 2 days over the weekend, and they don't really do much Monday through Friday, or they play basketball and they sprain the ankle and they're not really in shape. So, I will help them get better, but at the same time, I'm really into preventing it from happening again. So why did this happen? So is there training issues? Are there, just nutritional issues? Just anything we can do if the patient's interested to get them back on the field, so to say, and get them healthy and keep them going that way. But speaking about children, one of the things that children come in for are like plantar warts. And plantar warts is little viruses that are highly contagious. And, the parents and the child are definitely afraid to go to the doctor because they think we're just going to cut them out. But I have this wonderful ointment that I put on after about 3 to 4 treatments. We usually get rid of all the warts, and it's painless. It's just a wonderful thing. So I try to be as painless as possible with children.
Sure. So basically, podiatry is not only here to fix things, but you can, like with sports people, with children, you can actually help them to stay in shape better, get less hurt in the first place, and maybe even improve their game. Is that what you're saying?
Absolutely. And I totally understand too, because I just completed my first half marathon a couple of weeks ago. And I know how it feels to train and running in about a pouring rain at 45 degrees weather, and just knowing around the 10-mile mark my legs are getting cramped and how to make sure I continue, and I did fine. So I understand the running nature.
Well, we'll be talking more about specific areas in that foot there, and that's when you will explain us some of the stuff. Thank you very much. Very enlightening.
Thank you very much, Tom.